Good afternoon, everyone, and welcome to the third day of the Women's Health Summit. Thank you to the 92nd Street Y team for organizing this amazing event, and to the Katz Institute of Women's Health and Nancy and Larry Roth for their continued support in sharing knowledge and resources to help you take charge of your own health and wellness. I'm Dr. Jennifer Mieres, Professor of Cardiology at the Zucker School of Medicine at Hofstra Northwell, and a Senior Vice President and Chief Diversity and Inclusion Officer for the Center of Equity of Care at Northwell Health. We know that women make up over half the population, and yet their very unique health experiences are consistently lumped in with men's. This means women's health issues are often misdiagnosed, mistreated, or sometimes just plain missed. This is especially apparent in heart disease. Heart disease is the #1 killer of women in the United States, killing more women every year than cancer, chronic lung conditions, accidents, and Alzheimer's disease combined. Because heart disease has historically been considered a man's disease, many women lack an awareness of their potential risk or even the different types of heart attack symptoms women may experience. And at this moment in time, 90% of women, all of us in the United States, have at least one risk factor for heart disease. Although these factors can seem scary, there's good news. Even small changes in nutrition and in lifestyle habits can lower your risk of a cardiac event by as much as 80%. According to the American Heart Association, the science shows that 80% of heart disease can be prevented by simple lifestyle changes. Preventing or reducing the chances of heart disease is something you're never too old or too young to think about. Without a doubt, the best defense against heart disease is to be empowered. By taking charge of your health and being knowledgeable about the risk factors and the symptoms, you can successfully battle against the leading killer of women in the United States. Today, you will hear from a group of experts on heart health. Who will be sharing tools and tips to help you live a heart-healthy life. Our first session today features Dr. Tara Narula, Associate Director of the Women's Cardiovascular Disease Center at Lenox Hill Hospital and Assistant Professor of Cardiovascular Medicine at the Zucker School of Medicine at Hofstra Northwell. And she is joined by Nancy Brown, Chief Executive Officer of the American Heart Association. We will also welcome a panel of heart health experts to speak to you about cardiac prevention, including exercise and heart-healthy nutrition. They will talk about the connection between heart health and obstetrics, as now we have learned that pregnancy complications can serve as a gender-specific risk factor for cardiovascular disease, as well as we'll talk about the connection every woman should know about cancer care and heart disease. Ladies and gentlemen, our panel of experts.
Hello, I'm Nancy Brown, Chief Executive Officer of the American Heart Association. I am so pleased to be with you today at the 92Y's Women's Health Summit. Thank you so much for joining us as we discuss a vital topic, women's heart health and well-being. The alarming fact is cardiovascular disease is the #1 killer of women, causing 1 in 3 deaths every single year. And while that may sound like just a number, it's not. It's our mothers, our daughters, our sisters, neighbors, colleagues, and friends. It could be you or even me. 1 in 3. This is the price women are paying with their lives to cardiovascular disease, and it's a price that we will no longer pay. Losing even one woman, one mom, one friend is too many. And the COVID-19 pandemic has heightened the urgent call to action, given the long-term effects of the virus on survivors' hearts, brains, and vascular systems. So you might be asking, how do we combat this? We need more knowledge, and knowledge is informed by science. We'll discuss this in more detail during our conversation today. And for the conversation, I am just honored and pleased to be joined alongside a great friend, an advocate, and a longtime champion for women's health, CBS News medical correspondent, Dr. Tara Narula. Today, we'll discuss not just the issues, but what we can all do to make an impact, to reduce our risks, and to live our best, healthiest lives. Dr. Narula, welcome. We are so honored to have you. And will you share a little bit more about your background and your expertise?
Absolutely. And thank you so much, Nancy, for the invitation to be here today. Obviously, this is an issue that's close to my heart. I work as a general cardiologist here at Lenox Hill Hospital in Northwell Health in Manhattan, but I'm also the associate director of the Lenox Hill Women's Heart Program. And so we specifically focus on helping women keep their hearts and brains healthy and reducing cardiovascular disease. So this is something that we discuss every day with our patients in our office here in Manhattan.
Yeah. And, it's so clear that this topic of women's health overall is critically important, and I think really highlighted during the pandemic. And, from where we sit at the American Heart Association, and Tara, we've had this conversation over many years. We know that men and women are biologically different. We know that men and women have different symptoms, and that women have unique risk factors in life events such as pregnancy and menopause that can impact their cardiovascular health. Can you give us your perspective on the unique factors that women experience that might put them at a higher risk for developing cardiovascular disease?
This is such a great question, Nancy. And I think for so many women, they may have heard about things like high blood pressure and high cholesterol and diabetes and smoking, but they may not be aware of those things, as you mentioned, that are specific to women. And by that, we're talking about, for example, things that happen during pregnancy. So if a woman develops gestational hypertension, gestational diabetes, preeclampsia, eclampsia, or even preterm delivery, this can be a marker of increased risk in the future. Outside of that, we think of things like polycystic ovarian syndrome, obesity, which plays a bigger role in women, as does smoking, and then men, migraines, and then some of the inflammatory conditions like lupus and rheumatoid arthritis, as you mentioned, menopause or early menopause, and in addition, menstruating before 10 or after 17 years of age. And then when we look at cancer, it's important to understand that what happens to a woman in terms of her treatment, whether she had breast cancer and she received chemo or radiation or other forms of cancer, chemo or radiation may increase a woman's risk. So all of these specific factors to women are really important to understand and for a woman to bring up with her doctor to discuss.
When we think about how do we know about these factors and their impact on women and the difference of women and men, it's because of science and because of research. And it is a fact that women have historically been underrepresented in research, but really it's more than that. At one point, women were actually excluded from participating in research. In 1993, which is less than 30 years ago, it took an act of Congress to mandate the inclusion of women in government-funded research. We know how important it is to study the effect of all of these issues on women. And that's why at the American Heart Association, we engage women from all communities to take charge of their health and protect their hearts through our Go Red for Women movement. We're engaging more women in research through Research Goes Red, our partnership with Verily, and we hope to level the playing field for women to enter and advance their careers in science. You sit in such a unique place because you are a clinician and a scientist and a communicator of scientific information to the public. Give us your perspective on why it's important for women to engage in research, why it's important for more women to go into STEM careers, and just your thought on how are we doing on women being represented in clinical studies?
Well, this is, again, such an important message for women to understand that we talk about women being understudied, underdiagnosed, and under-researched. And in order to understand the biology of women, in order for us to design the appropriate therapies, whether that's drug therapy or device therapy, we need to understand how these things interact in a woman's body. And so women certainly need to be in the driver's seat, and that means participating in research. And now more than ever, through the programs that you have so championed, women can take on that role of participating. It's so easy these days for women to become involved. And it's because of our research on women that we've learned about conditions like spontaneous coronary artery dissection, like broken heart syndrome or Takotsubo, or microvascular disease. These are conditions that we really see much more often in women, and speak to the fact again that women are not small men, that their biology is different. And so absolutely, I think it's critical that women not only join in research trials, but that women do join in the fields of STEM, because that way they can lead, they can be the voices to push forward for the research studies that we desperately need.
Just a personal question, Tara, how did you get interested in becoming a doctor? You know, as a young woman, was science something that was on your mind when you were young, or were there people that inspired you to follow your career?
Well, I have to say, from the time I was very little, I always loved science. I went to science camp when I was a young girl. I volunteered in the Department of Cardiac Surgery when I was in high school, and I got to see a heart transplant. But I think the biggest factor was my mom was a nurse and my father was a cardiologist. And so I used to spend weekends sometimes going to the hospital with my dad, making rounds, and just seeing that interaction with him and his patients, and the type of doctor he was, and what cardiology was, and how much we could offer to our patients. It's such an incredible field. And I really got that firsthand glimpse from my youth. And of course, I had parents who really nurtured that and encouraged me to go into science and to become a physician.
Yeah, it's so important, you know, how these interests of ours start really young in life. And that's why STEM programs, especially that we offer through Go Red for Women, are really important to help young girls, especially, and young girls of color find their interest in science and medical, professional and research oriented careers. So thank you for sharing your personal journey. Let me switch topics a little bit. We at the American Heart Association recently released a scientific statement about the importance of the mind-heart-body connection, something that's on all of our minds, especially since the pandemic. And research suggests that high levels of stress hormones, such as cortisol, can, over time, raise blood pressure, cholesterol, and blood sugar, common risk factors for heart disease. We also indicated in that paper that mental resilience doesn't mean you don't have stress. It means you're better equipped to adapt to stress and handle life's challenges. We at the AHA, especially during Heart Month and Go Red for Women Month, talked about the 5 Ps: people, physical activity, positive outlook, practicing mindfulness, and if necessary, professional help. This paper, I think, is really important because we don't talk enough about the fact that the mind and the body are connected. How do women initiate a discussion with their doctor about these topics, and what can clinicians do to help inspire women to recognize that it's okay if there's some anxiety and, you know, some concern that people may have? I think this is a wonderful opportunity for all of us to realize this is much more common than people probably talk about.
Absolutely. And I'm so glad that you're bringing this up, because I spend a lot of time in my exam room with my patients actually talking about their mental health. And I think many times women are surprised when I ask them, do you have a history of anxiety or depression or PTSD? How much stress are you under, and what are you doing to manage that? And it really is breaking down the stigma around mental health. Number one, first and foremost, opening the door to that conversation and saying, this is a safe place to talk about it. But number two, recognizing that there is that connection, and that I always tell them, you know, the better controlled those things are, the better controlled your heart and cardiovascular health is going to be. And so there is a direct interaction between the two. But thankfully, I do believe that we're in a new phase in this country where there is much more awareness about mental health and people are talking about it. And I often refer my patients to therapists or to psychiatrists to address a lot of these things. And there's no doubt that this past year with COVID, we've only seen an increase in so many of these conditions, particularly in women who've been wearing many, many hats during the pandemic as caretakers, as teachers to their children who may be home, working at the same time. So if ever there was a time to really break down those barriers and for women to be encouraged to open up about these topics, the time is now.
So well said, Tara. Thank you.
Thank you, Nancy. And, I wanted to ask you in particular, how do you believe that any of our guests watching today and others can get involved and really make an impact?
Thank you so much for that great question, Tara. I think they follow right along the themes we've talked about today. As women, we have an opportunity, and I would say an obligation, first of all, to participate in research. If we want there to be scientific knowledge about how certain diseases or therapies or treatments uniquely impact women, we have to be willing to participate in research. And I mentioned Research Goes Red that we have created with Verily. It literally puts women in the driver's seat to accelerate scientific discovery. We encourage people to get involved as deeply as you might like to. We do a lot of surveys to understand how people feel about certain issues, all the way to collecting medical information. And it's really easy to get involved. You can go to goredforwomen.org/researchgoesred. The second thing I would say really ties into the points you were just making. I think that as women, we need to make ourselves a priority. Even before the pandemic, women were juggling. And as you just so well articulated, from mom to teacher to employee to good neighbor to caring for elderly parents and just in general caring for people around us, the demands on women are greater than ever. And we know that mental well-being is affected. We know that women are reporting more sleep problems, depression, and anxiety. And so we want to help women not have those stressful experiences impact their heart health. So take care of yourself, get enough sleep, pause, rest, journal, take time during the day to write down how you're feeling. The other thing about taking care of yourself is to know your numbers. Heart disease is largely preventable. So know your numbers, like your blood pressure, your cholesterol, your body weight, your blood sugar, and please do not smoke, because we know that that is a direct line to developing many diseases, including heart disease. We would ask you to be mindful of the disparities and inequities in healthcare and to use your voice to influence change. Although we have seen declines in the death rate from cardiovascular diseases, not all populations have benefited equally. Health inequities are on all of our minds, and certainly they've been highlighted during the pandemic. We know, for example, that while Blacks make up about 14% of the US population, the CDC reports that they account for over a quarter of all of the people who are hospitalized with COVID-19 and are 4 times more likely to die from the disease compared to white populations. So, we shouldn't say that that's okay. We need to stand up to change that. We need to change healthcare access and quality, and we need to have our voices make changes to the way that people access the healthcare system. I would just say at the American Heart Association, this is a major priority for us and our 2024 goal. And we recently announced about $230 million of commitments to address issues of health inequity and structural racism, because we know that they lead directly to poor health and to premature death from heart disease, from stroke, and from many other diseases as well.
Thank you so much, Nancy, and to everyone at the HA who's been so committed to leading the cause against this leading killer of women in our country. And I think that this is a fight that we can win. And you brought up the COVID pandemic, and there's no question we've seen this year that if we put our energy and our resources and our time into fighting heart disease and stroke the same way that we've done with COVID, there's no doubt in my mind that this is a battle that we can win, but we have to approach it in the same way. And I agree. I think, for women, understanding their risk factors, recognizing their symptoms, and really prioritizing themselves. And that is the key, because not only does a woman have the power to affect her own life, but she is so well positioned to make these changes that will then have a ripple effect to help the lives of her female friends, of her mother, of her daughters. And that's really what we want to see. We want to see change happening and then spreading to all of those women that she loves, because she's able to educate them about the steps they can take.
Yeah. That's such a great insight, Tara. And, you know, it reminds you of the old quote, you know, every day, make sure you practice kindness and graciousness to other people, because the power of our words to others, you never know what kind of impact you can make to someone, whether they're having a great day or a not great day. You know, to let someone know how much you care about them really matters. And I think that's what this women's health movement is all about. You know, we are a sisterhood. Let's stand together. Let's care about ourselves and each other. Let's participate in research because it benefits the greater movement of women. And that is a wonderful thing. And it's a great way to give back to society. And so as we close today, I do want to thank all of you for joining us. Thank you for being advocates, not only for your own health, but for the health of others as well. I always have to give a special thanks to Dr. Tara Narula. You know, you are a wonderfully passionate and long-term leader of the American Heart Association, and you are a force in women's health. We are all so lucky to have you as an AHA volunteer. Your listeners are happy and lucky to have you, and I know your patients are as well. You bring such great expertise. Thank you for all you do. And also thank you to 92Y for their commitment to bring essential conversations just like this one to their audiences. And finally, I would encourage each of you to join the American Heart Association's Go Red for Women's initiatives to learn more about how you can make an impact and about how you can improve your own health or help a woman you know improve hers. Thank you so much.
Hi, everybody. Welcome to Chair Yoga. My name is Lisa Bondy, and I'm from the Center for Wellness and Integrative Medicine of Northwell. Let's come to sit on the chair. Make yourselves comfortable, but at the front of your seat, please. Feet are hips distance apart. Let your hands rest on your thighs. Close your eyes and invite your attention inward. Turn off all of the external stimulation. In your mind's eye, see your feet on the floor, hips distance apart. Your knees right above your feet. Follow your femurs from the knees back into the hip joints and press your sitting bones down into the chair. On your next inhale, feel your rib cage kind of float up, away from your hips. And as you exhale, relax your shoulders back and down, feeling your head floating like a helium balloon above your shoulders. Take a deep breath in through your nostrils. Fill to the bottom of your lungs, into the sides, and all the way to the upper chest. Pause, and exhale slowly from your nostrils, feeling the rib cage contract, the belly push back and up. Connect to empty and hold for a moment. And inhale again. Breathe deep into your body. Feel that expansion. Hold. And exhale slowly, emptying the lungs, connecting to empty and hold. And let's do it one more time. Inhale. Fill all the way up. And this time as you exhale, let your chin drop in and down toward your chest. Inhale, lift up your chin, tilt it up, and exhale the head back. Stretching the front of your throat. Inhale, center, and exhale, chin down, the chest up. Feel the back of your neck stretching. Inhale, center, and exhale, just turn your head over to the right like you're looking over your shoulder. Inhale, center, and exhale, head to the left like you're looking over your shoulder. Inhale, center, and exhale, lower your right ear towards your shoulder. Let your left hand hang down and hold the bottom of your seat. Lean over and feel that stretch in your neck and your shoulder, and breathe. This is really good. We tend to build up so much tension in our necks and shoulders. And let your chin drop down and feel that stretch climb up the back of your neck. Nice, and come back to center, take a breath in, and exhale, lower your left ear toward your shoulder. Let your right hand hang down, hold the seat, and lean over to the left. Yeah, so yoga really helps us to release stress and to shift out of that stress mode in the nervous system and into the rest and digest parasympathetic response. Makes us feel so much better. And let your chin drop down, releasing the stress in the back of the neck. And come back to center. Hands on your thighs, and we'll do a little bit more for the shoulders. Inhale, the corners of the shoulders forward and up, and exhale them back and down. And again, inhale them forward and up, and exhale back and down. Always connecting the breath and the movement. Again, inhale them forward and up, and exhale back and down. Good. And inhale, lift the arms up, reach up. We're going to kind of climb a rope here. Feel your waist elongate. Breathing as you climb. Good. And then stretch up through both sides and reach the arms forward and straight back, holding the back of your chair. Lengthen your spine. Inhale, expand through your heart space. And exhale here. Imagine you have a sun shining out of your chest and project out light and love and breathe. Good. And take a deep breath in. And exhale, round back. Cross your arms over your thighs, chin into chest. And inhale, rise. Hold the back of your chair, lengthen, look up. And exhale, squeeze and round in. And one more time. Hold the back of your chair, lengthen up, inhale. And exhale, squeeze, round in. Good. And lift up nice and tall, hands on your thighs. We're going to move the hips around a little bit. Press your left foot down. Inhale, right knee up. Hug it in. Lift up tall and take the knee to the side and center and to the side and cross the ankle over the knee. So keep that knee up high. Lift up tall, turn to the right. Bring your right hand to the back of your chair and hug that right knee across your body. Inhale for length and exhale, turning. Take a couple of breaths here. It's really nice for the hip, the low back, especially when you've been seated for a long time. And come back to center, ankle will cross over knee, making like a number 4 here. Take the hands to the foot and the knee. Take a breath in and exhale. Just come up and forward. Let your breath lead the way. Breathing into the low back. Feel that stretch. Good, and rise up, everybody. Hold behind your leg, extend it out, take a breath in, and exhale, bend it. And one more time, extend and bend. And we're going to circle the ankle in one direction and then the other. Good, and lower down. Pressing that right foot down, inhale, left knee up and hug it in. Lift up, take the knee to the side and center, to the side, and cross the ankle over. Same thing, other side. Twist to the left, left hand to the chair. Hug that left knee across your body. Breathe. Good, and exhale, come back to center ankle over knee, make that 4. Hands to the foot and the knee, sit up tall, take a deep breath. And exhale, coming up and forward. Good, and breathe into that stretch. You might be feeling something here. Nice, one more breath. Good, and rise back up. Inhale, lower your foot. Let's come up to stand, everybody. And just turn to face the seat. And place your palms on your chair and walk your feet back. Pull the hips back. And let your head come in line with your arms. And feel that stretch in the back. Breathe into it. Breathe into your back body. It's so nice to get this stretch after sitting for a long time. Look forward. Step your right foot up to the leg of the chair. Bend that knee. Push into your back foot. Lengthen your spine. Inhale. Coming into our warrior 1. Lift the body away from the chair and lift the arms up. Inhale. And breathe. Exhale the hands back to the chair. Keep your keep your left hand on the chair and bring your right hand to your back. And take a turn to the right. Feeling that nice stretch, the nice twist, and pressing into your back foot, feeling that stretch behind the leg, and breathe. Twisting is really great for stimulating digestion and metabolism. If you ever feel stuck, it's a great thing to do. Hands back to the chair. Step the front foot back, let the hips pull back. We call this downward dog on the chair. And step your left foot up to the leg of the chair. Bending that knee, pushing into your back heel. Lengthen your spine. Feel grounded in the feet. Lift your body. Lift the arms. Take a breath in. And lower the shoulders, exhaling. Breathe here, feeling the steadiness. From the navel down, the groundedness. And from the navel up, feel light, like you're ascending toward the heavens. And exhale the hands back to the chair. This time, your right hand stays on the chair. And your left hand comes to your back. Lengthen your spine, inhale. And exhale, twist, turning that left shoulder up. Pressing into your back heel, breathing. Good, and come back to center. And from here, let's step the feet wider than the chair. Lengthen the spine. Take a breath in and exhale, lower your elbows to the chair and let your head drop. Yeah. So it looks something like this. Head drops. Breathing here. Nice. And we're going to lift back up, come up to stand. Stand nice and tall. Lifting tall through the crown of the head. Turn your palms out. Inhale, lift the arms up, gaze up. And exhale, lower the arms. And come to sit. Back into your chair, hands on your thighs. Close your eyes. Take a moment to come back inside. Notice how much more relaxed you feel in your body. Notice how much more clear and calm you feel in your mind. Notice the lift in your spirit. Inhale your palms together at your heart center. And exhaling, bowing your head down in gratitude to yourself and your practice. Thank you so much.
Hi, I'm Eugenia Gianos, the Director of Cardiovascular Prevention at Northwell Health and the Director of Women's Heart Program at Lenox Hill Hospital. Today, I want to talk to you about cardiovascular prevention in a woman over her entire lifespan. So I'm going to start with some really interesting statistics. By the year 2035, about 45% of the United States population is projected to have some type of cardiovascular disease. And every 36 seconds, someone dies from a cardiovascular event. Really shocking statistics. And for me, although these are really shocking, this really didn't hit home until a good friend of mine ended up having a cardiovascular arrest at the age of 48. And when I think back to the factors that contributed, I wish that we could have recognized them earlier. So, question for everyone, which of the following risk factors put people at risk for a heart attack? Is it age, abnormal cholesterol, high blood pressure, obesity, a family history of early heart disease? Well, it turns out that all of these put someone at risk for heart disease, and we need to recognize them as early as we can. The reality is that what we end up doing in medicine is we take care of things at the end stage of disease instead of really targeting it from the very beginning where we can prevent things. We end up mopping up the floor when we could have simply turned off the faucet. And when it comes to women, I would say that there certainly are a number of differences between men and women, and we need to be attuned to all those differences. And in terms of cardiovascular disease, there are all these unique syndromes in women where you can have a tearing in the artery of a woman's heart. You can have small vessel disease instead of the usual type that we see in the bigger arteries. You can have issues from stress, things related to treatment for breast cancer or hormone related, all of which we need to be able to recognize. However, when it comes to heart disease and a process we call atherosclerosis, I would argue that in that case, the most common thing that we see, that's when we should actually be thinking just the same as we do in men. We should be thinking aggressive treatment. We should be thinking early recognition and targeting whatever we can to prevent heart disease in women. It turns out that unfortunately in women, we often miss the boat. Young girls are not always encouraged to be as active as boys. Sometimes eating disorders will be more common in women. Heart disease prevention is sometimes postponed until after a woman has already gone into menopause. And often we hear things like, oh, women shouldn't really be treated during their childbearing years, which is a huge mistake. We really miss an opportunity to prevent disease early in a woman. So the next question is, which arteries in the body are really involved in the process of atherosclerosis or blocked arteries? Well, is it the arteries of the heart, the neck, the legs, the arms? Well, it turns out it's all of the above. In fact, this process of atherosclerosis or plaque development is occurring throughout the body. But the good thing about that is that we can target it all in the same way. So there's a lot of risk factors for heart disease. Some of them are very typical things we've known about for years, like high blood pressure, cholesterol, diabetes, et cetera. But there are also some newer recognized risk factors, particularly in women, diseases that have to do with inflammation, like rheumatoid arthritis or lupus, early menopause, or even complications during pregnancy that may suggest that a woman is at higher risk. So we need to be aware of all those different risk factors. But the good thing is that if we can get our risk factors, our sugar marker, blood pressure, cholesterol, smoking, weight, diet, and physical activity into an optimal range, if we can get all of those under control, we can pretty much prevent most heart disease from occurring ever in our lifetime. So the field of cardiovascular prevention, which I'm very passionate about, is a really great emerging field. There is a lot of attention to individualized risk assessment, really going through all the details of a person's history to understand exactly what they're at risk for. And then the field of genetic testing has advanced tremendously so that we're able to recognize within families people who might be at risk so we can target them early. We also have advanced blood testing. We have different tests that we can do with respect to imaging. And we have a lot of things that we can do with respect to treatment from a lifestyle standpoint and from a medical therapy standpoint. Now, when we talk about what to treat people with and which things that they're at risk for, there are a number of patients who already have disease. And in that case, it's called secondary prevention. Essentially, it means that somebody already has had a heart attack, a stroke, or perhaps just blockages in their arteries in some form. In those patients, it's very clear that they have a need for cholesterol-lowering medications called statins, and for something that blocks their clotting, which usually is aspirin or a similar medication. Now, when it comes to patients who don't already have heart disease, something we call primary prevention, that's where it's more complicated. And we really need individualized therapy. And the good thing is we have apps that we can use to plug in somebody's number and then come up with their exact risk over a 10-year frame. But when we're not sure still, we have testing like coronary calcium scoring, or also a test of the arteries in the neck to look for plaque. We can also even see things like calcification on a mammogram that might suggest that a woman is at higher risk for heart disease. So we have lots of tools, and we really need to apply what we learn from these. The good thing is that lifestyle medicine is a huge component that we can influence as well. I frequently hear from people, well, you know, if I have a high genetic risk and everyone in my family has heart disease, does my lifestyle even really matter? Well, yes, in fact, it does. It turns out that you can be born with a very high genetic risk, and you can cut that risk down by half just by having a healthy lifestyle. But similarly, you could be born with a very low genetic risk, and you can double your risk with a very poor lifestyle. So it's so important. In fact, I understand that when you're trying to work on diet and you look in the media and you check out what's out there, it's quite confusing. There's so many diets being recommended for heart health or for weight loss or for different things. So the question is, which diet do we not recommend for heart health? Turns out that a vegetarian or a vegan diet is very much ideal for heart health. A DASH diet used to stop hypertension, or Mediterranean diet are all really healthy diets that are recommended for heart health. The ones that we don't suggest are ones that are predominantly animal-based or very much processed foods. So really being careful as to what kind of diet you're going to follow. And fortunately, we have very good evidence of diet trials with, for example, the Mediterranean diet showing that you had a 30% lower risk of having a cardiovascular disease over the course of their trial, about 5 years, if you followed a Mediterranean diet that was supplemented by either nuts or extra virgin olive oil. So very important information, because the diet itself lowered risk practically as much as medications do in most cases, and perhaps even more. And it turns out that the more vegetarian food you had in your diet, the more you were able to lower your risk of dying over the course of the trial. So I think these are really important points. What we should really be doing is simply moving along a spectrum in a simple manner where we're changing out foods that we know are not good for our health: saturated fats, trans fats, red and processed meats, sweets and refined carbs, and really just exchanging those for vegetables, legumes, whole grains, nuts, and fruits. And by doing that, even if it's one change, we improve our health. So I don't recommend dietary supplements. I don't recommend that people take pills to improve their health specifically in the supplement field. But I do recommend that they get those supplements in food, in antioxidants, vitamins, omega-3 fatty acids, all of which are present in healthy foods. It's also really, really important that we get physical activity, at least 30 minutes a day. And if you're wanting to lose weight, you might be aiming even for about 60 minutes per day. Trying to get 10,000 steps a day is also a great option for getting yourself on track, and even just trying to dance and move around. So all of these are acceptable forms. And lastly, I would say it's really important, especially in this day and age when there's so much stress in our lives for various reasons, that we work on controlling that stress, because it's very much tied into our heart health. And I would say women often carry a lot of this burden because they tend to be care providers. So some of the ways that we can do this is really simple things. Make a to-do list, prioritize, try to delegate, get others to help out in areas, have a positive attitude about your life. You know, when you approach things in a different way, you often do much better. Play music. It will brighten your mood. Really start to relax and figure out ways that you can allow yourself downtime. Making sure to get enough sleep is also key, and enjoying time with family and friends. And something I do in my clinic, I often am told about how patients are quite busy in their lives. And let me tell you, I get it. It is so hard when you have so many things to manage and then trying to fit in exercise and diet in the middle of all that. So some really simple things: pack some healthy snacks with you to make it easier. Figure out in your area which takeout places have healthy options. So when you're in a hurry, you can go and grab something easily. Try to exercise both days on the weekends, because at least those days, you know your time is protected. Walking and taking the stairs anywhere else that you can, and just bringing your sneakers with you when you're traveling. If you're on a work trip or you're on vacation, just a pair of sneakers can be enough to get you enough activity. So nowadays, we definitely, as cardiologists, as preventive cardiologists, understand that this is something, improving your health and your heart health, it really requires a team. And we encourage you to work with us when you can, with a dietitian, with a nurse practitioner, perhaps, that will counsel you, with somebody who will counsel you on exercise, sometimes with a psychologist who can help with your mood and your behavior change. We understand the need for a team so that we can target all aspects of health. So I encourage you to find out your own risk for heart disease and to really work with your healthcare provider to improve your risk and seek help. There are many of us out there in the preventive cardiology realm and women's heart disease. I'm happy to help you to make change and prevent disease. Thank you for your time.
Hello and good day. My name is Dr. Sonia Henry. I am a cardiologist in the Katz Institute for Women's Health. I'm the medical director of echocardiography at North Shore Manhasset in the Northwell Health System, and I practice cardio-oncology, and I'm here today to talk to you about cardiovascular disease prevention during and after cancer. Luckily, cancer survivors are increasing. Survivorship is up, mortality is down. We're estimated to see about 20 million cancer survivors at the year 2025. Providers and patients need to be aware of the cardiotoxicity associated with cancer and cancer treatment in order to improve cardiovascular health and improve outcomes in the future. There is an intersection of cardiovascular disease and cancer with shared risk factors and also increased inflammation. There's also the overlapping shared risk of cardiotoxicity that is important to understand from cancer treatment. The shared risk factors include increased age, a diet that's rich in animal products, a family history, increased alcohol intake, hormone replacement therapy with estrogen, obesity, physical inactivity, tobacco use, and genetics. So why is there this increase in cardiovascular disease after and during cancer treatment? Well, we have this increased baseline cardiovascular risk factors. We have the diagnosis of cancer. There's a decreased cardiovascular reserve that happens during treatment. There's indirect effects from lifestyle perturbations, decreased fitness, decreased activity, poor diet, increased depression. We have the direct effects from the chemotherapy and radiation. And these work in concert to decrease your health and increase your cardiovascular risk factors. So who is at risk? So patients over the age of 60, under the age of 10, female gender and African Americans are at increased risk for cardiotoxicity during cancer treatment. Patients who are at increased risk of cardiac dysfunction are those that receive doxorubicin or anthracyclines, left-sided radiation to the chest or breast, any dose of anthracycline in combination with left-sided or left breast radiation, any dose of anthracycline in combination of HER2 agents such as Herceptin and Perjeta, any dose of anthracycline in combination with HER2 agents or HER2 agents in itself in combination with cardiovascular risk factors such as hypertension, diabetes, high cholesterol, or cardiovascular disease. We should also be aware of anti-estrogen agents such as tamoxifen, which blocks the estrogen receptor used in premenopausal women. This increases the risk of arterial and venous thrombus about 1%. It increases the risk of blood pressure, and it actually changes the cholesterol, maybe decreasing the cholesterol 10% for your total cholesterol and decreasing your LDL about 15 to 22%. The aromatase inhibitors, again, which decrease estrogen production, really focus on postmenopausal women and does increase your risk of blood pressure, as well as increase your total cholesterol and LDL about 10 to 25%. So what is the impact of cardiovascular risk on cardiac events among breast cancer survivors? When we look at patients who have diabetes, hypertension, or coronary artery disease or CAD, we see that these patients are at increased risk of incidence of cardiac events. They're higher than those patients without these risk factors. So this reminds us to really be focused on control of cardiovascular risk factors in order to decrease cardiac events in breast cancer and all cancer survivors. We also have decreased fitness after breast cancer treatment. There is about a 30% decrease in your fitness before and after cancer treatment. So it's important to exercise during and after cancer treatment. And this has been proven to reduce cardiovascular events and cardiovascular disease and outcomes in the future. How much exercise is important? Well, you can just power walk about 3 to 5 minutes. And that works out to be 150 minutes per week. That's 20 minutes a day, or 50 minutes of exercise 3 times a week. So what is the cardiac follow-up after cancer treatment? Well, it depends on what treatment you got. So if you've gotten chemotherapy with a cardiotoxic agent such as anthracycline, Herceptin, or Perjeta, you want to have an echocardiogram about 6 months to 12 months after that cancer treatment is completed. If you've had left-sided radiation or left chest radiation, the heart is under the left chest, and so your heart may have been exposed to radiation. So it's really important, again, to have an echocardiogram 6 to 12 months after the radiation dose, and also consideration for functional stress test, echocardiogram and stress test 5 to 10 years out after this treatment. The good news is that 80% of heart disease is preventable through education, lifestyle changes, and partnership with your physicians. Risk factors that can't be controlled, of course, are your age and your gender, your hereditary, your race, previous cardiovascular disease, and if you've had cancer or cancer treatment. But we can manage your hypertension, your high blood pressure. We can manage your smoking. We can manage your cholesterol. We can increase activity, decrease our weight, and control our diabetes. It's really important for a cancer survivor to be treated to goal. We have to know our numbers. It's really ideal for your cholesterol to be less than 200, your blood pressure to be less than 120/80, your fasting blood sugar to be less than 100, body mass less than 25. You abstain from smoking. You definitely engage in physical activity. As I mentioned, 150 minutes per week is ideal. And maintain a healthy diet, which should be focused really on a plant-based diet to decrease your risk of both cancer and cardiovascular disease. Really, these are small steps to better health, to stock your kitchen with healthy foods, to take control of your activity, really take your medication when indicated, and really, again, partner with your physician and sleep more to decrease your stress levels and really save your life. Every cancer survivor should have a survivorship care plan. You need to know your cancer diagnosis, the stage, the biology. You should have a list of all of your cancer providers, your surgeon and oncologist, a summary of all your treatments, the name, the dose of the agents, if you've been radiated to the chest, and ideally the mean heart dose associated with that. A plan for surveillance. How are we going to follow your cancer? Through mammogram, CAT scans, or MRIs. We should be aware of symptoms for recurrence. And it's really important to have a long-term follow-up plan for your cardiovascular health, your bone health, or other related cardiovascular and health complications from your treatment. It's important, again, to partner with your physician to practice preventative care and a healthy lifestyle. And specifically, with the focus of cardiac surveillance for cancer survivors who have had cardiotoxic cancer treatment, an annual history and physical with an electrocardiogram is important. A personalized risk-based plan is important. Remember, our adult cardiovascular risk factors do not take into consideration if you've been treated with cancer therapy, with chemotherapy and radiation. It does not take into account that risk. So you really need to focus on aggressive risk factor modification. A, B, C, D is the acronym ABCDE. So A, awareness for risk of cardiovascular disease, assessment of those risk factors. B, which I'll star, it's blood pressure control. C, cigarette cessation and cholesterol management. D, dietary counseling and diabetes management. And E, of course, exercise promotion. It's really important, again, to get an echocardiogram about a year after if you've had cardiotoxic chemotherapy, cancer treatment agents, as well as radiation. And certainly a functional stress test is indicated 5 to 10 years after radiation. Thank you so much.
Hi, I'm Dr. Catherine Weinberg, and I'm so excited to be here with you today to be able to talk to you about such an important topic, pregnancy and heart disease. I'm the director of the high-risk cardiovascular obstetrics program here at Lenox Hill Hospital, Northwell Health. Cardio-obstetrics is such an important topic. It's a developing field in cardiology. We provide care and expertise to women who are pregnant with heart disease. We collaborate closely with your MFM, maternal fetal medicine, and OB to provide better outcomes for women with heart disease. Did you know that up to 4% of pregnancies involve some kind of heart disease? It can either be acquired, meaning you develop it, or congenital, meaning you were born with it. That's about 4 million women in the US. Unfortunately, pregnancy-related deaths in the US are actually on the rise, and there's about 700 deaths per year in the US. The #1 cause of pregnancy-related death in the US is heart disease. Heart disease and stroke cause more than 1 in 3 deaths in pregnant women. According to the CDC, 3 of 5 of these deaths are preventable. And so it's our job as healthcare providers, physicians, nurses, and other providers to work together to change these statistics. But we need your help. So how can you help? How can you decrease your risk during pregnancy? How can you help other women? Well, I'm going to go through 3 ways. The first way is I want you to understand your risk during pregnancy. We know if you're over the age of 40, you have 30 times the risk of someone who's less than 20. If you're an African American woman, your risk is about 3.4 times higher than Caucasians. We know that African American women, Asian women, and Hispanic women experience a higher proportion of adverse events during pregnancy. They have more severe clinical presentations and worse outcomes than white women. And we need to change this. But that's why we need to understand what's going on. Not only is age a risk factor, but we know that more women with obesity, diabetes, hypertension, chronic heart disease, and congenital heart disease, those numbers are increasing, and those also increase your risk during pregnancy. We know that if you have hypertension, diabetes, or obesity during your pregnancy, you are more likely to develop preeclampsia, gestational diabetes, small for gestational age, and preterm delivery, which then puts you at higher risk for developing cardiovascular disease in the long run, being heart failure, a weakened heart, or ischemic heart disease, meaning a heart attack, or even something like atrial fibrillation. So if you do have pre-pregnancy risk factors, we want to change your risk, especially for preeclampsia, and there's something we can do about it. We know that if you have risk factors for preeclampsia, such as your age, if you've had prior preeclampsia, chronic hypertension, diabetes, or a multitude of other reasons, if you start aspirin before 16 weeks, that risk is mitigated. Preeclampsia, for those who don't know, is high blood pressure after 20 weeks during pregnancy with liver and potentially kidney damage. And we know this can occur not only during pregnancy, but postpartum. So symptoms of preeclampsia to watch out for are headaches, change in your vision, trouble breathing, nausea, vomiting, swelling of your hands and your legs, sudden excessive weight gain. You can have pain in your upper right shoulder or belly and headaches. And we always look for protein in your urine. And if you ever have a blood pressure over 160 over 110, that's an emergency and you need help right away. So just call your doctor. The second way we can decrease your risk during pregnancy is to optimize your heart health prior to becoming pregnant. We say in cardiology that pregnancy is like running a marathon. And just like a race, you want to train and prepare, because pregnancy does not just affect your uterus, it also affects your heart. We know that it changes your heart rate, it changes your blood pressure, as well as something called your cardiac output, which is how much blood gets pumped out of your heart every time it beats. If you have underlying heart disease, whether congenital heart disease, meaning you were born with it, valvular heart disease, something like aortic stenosis, a cardiomyopathy, meaning a weakened heart, or ischemic heart disease, meaning you've had a heart attack, your risk of developing complications during pregnancy is significantly higher. Your risk of heart failure and arrhythmias, as well as risk to the fetus, meaning premature birth, and that's double the risk if you have underlying heart disease. So we know that if you have heart disease, we want you to be evaluated before you become pregnant, because we know if we do that, your outcomes are so much better. But not only do I want you to get evaluated before you become pregnant, I want you to be evaluated after you get pregnant for up to a year after you deliver. We know that without counseling, you have twice the risk of heart failure and death during pregnancy. So it's so important that if your doctor suggests that you need imaging, so an echo, a CAT scan, MRIs, if you need a stress test, or if you need any kind of intervention, meaning surgery, a cardiac catheterization, that it should be taken care of before pregnancy, because you'll have better, you'll do better during your pregnancy. Not only do we want you to address any types of imaging studies that you need or procedures that you need, but I also want you to address your medications. There are many women who are on hypertensive medications, and some of them are contraindicated during pregnancy. Things like lisinopril, which is an ACE inhibitor, or a statin to lower your cholesterol. Those are contraindicated during pregnancy, and we want to take women off of it before they become pregnant. But we also need to treat the underlying condition. So if you have hypertension and are considering becoming pregnant or are pregnant, don't just stop the medication. You need to talk to your physician about what medication is appropriate for you. Because we know if you ignore your high blood pressure or your diabetes during pregnancy, your outcomes will be worse. The third thing I want you to do is I want women to learn to recognize symptoms of heart disease. And the truth is, this is very difficult. If you've ever met a pregnant woman, they're tired, they're short of breath when they walk up the stairs, their heart rate is faster, they have swelling of their legs, and they can have pain in their chest because of GERD reflux. And sometimes it's very, very difficult to tell the difference. Is it pregnancy or is it heart disease? And that's why organizations such as the California Maternal Quality Care Collaborative have put together a list of symptoms. These symptoms are things I want you to watch for late during pregnancy and even postpartum, 1 year postpartum. If you have extreme swelling or weight gain, fatigue, if you pass out, if you have a persistent cough, if you have chest pain, someone sitting on your chest, something sitting on your chest and you don't feel well. If you have a rapid heartbeat and you're just sitting watching television, if you feel short of breath, especially when you're lying down, if you walk up the stairs and yesterday you could walk up fully, but today you can't walk 2 steps without feeling short of breath, those are warning signs, and those are when you need to call your doctor and ask for help. And if your doctor says, I don't think it's anything, and you do, you need to move on and talk to someone else to help you. We know that pregnancy does not end with just birth. Pregnancy extends out, and sometimes we even call it a 4th trimester. We know that death can not only happen during pregnancy, but 1 week postpartum, up to 1 year postpartum. So please make sure that even after you deliver, if you have symptoms, you seek care and you get the follow-up that you deserve. So what can we do? What can you do? I think there's so much we can do together to lower the risk of pregnancy-related death in the US. First, I want you to know your risk factors. Then I want you to optimize your health before you become pregnant. Get your consults, talk to your physicians, answer your questions. And then I want you to learn to recognize the symptoms of heart disease. Because if you're having symptoms, I want you to seek help. The sooner you get help, the better your outcome is. Our ultimate goal is to help women live healthy, productive lives and see their children grow up. Thank you.
Welcome to this wellness break. I'm Dr. Deborah McElligott, a nurse practitioner at Northwell Center for Wellness and Integrative Medicine, and I'm going to do a brief demonstration of tapping. Actually, tapping is a self-care practice that's incorporated into Tai Chi and Qigong, as well as some emotional freedom techniques that are often used. In traditional Chinese medicine, the belief is that acupuncture channels run up and down the body. When energy gets stagnated, we feel tense, we may feel pain, we feel tired. And this is a brief technique that's meant to move the energy around. So get comfortable. I should start off by saying, if you have a pacemaker, defibrillator, or you're pregnant, you're not going to be tapping on that particular part of your body. Otherwise, just put your arm out, make a floppy fist with the other hand, and gently tap up the body. And just notice what you're feeling. Tap on the shoulders, where we often hold so much tension. Tap down the back of the arm. And let's tap up again. In Chinese medicine, this is considered the acupuncture channel. Come across the chest and just tap on the sternum for a couple of moments, where we often hold so much tension. And the same thing on the other side. And again, you're noticing what you're feeling. It should feel fine. Nothing should be sore. Tap on top of the shoulders, down the arm. Come across. Now we're going to tap down the sides of the legs, starting with the hips all the way down to the ankles and then up the medial aspect. Bend down as comfortably as you are. Nothing should be tense or forced. Tap lightly on the belly. Hit the kidneys in the back. And you can shake that out. Now we're going to tap on our side of our hand between the base of the knuckle and the wrist. The karate chop, they call it. And this is part of the movement that's used with emotional freedom technique, or EFT. I'm not adding the words today. Now we're going to tap at the end of the eyebrows. And we're going to tap on the corner of the eyes. You can use 1 or 2 fingers, whatever feels comfortable for you. And you're not pounding hard, you're just tapping, stimulating that area, moving the energy around. Tap under the eyes. These are stomach points, also helpful with some sinus conditions. Tap under the nose. That's a great wake-up point if you're feeling sleepy, to stimulate there. Tap on the chin. Tap the clavicles on either side of the sternum. And then we're going to tap under the arms just to move that lymph around. Same thing with the other arm. And then we end with tapping on our head. And let's just do that one more time. The side of the hands. The side of the eyes. About 7 times in each area, or whatever feels comfortable. Under the nose, on the chin, either side of the sternum, on the clavicles. You can even extend that over and tap across. That's where the lung channel starts. Under the arm. And imagine that lymph just flowing through the body as you're stimulating it. Tap the top of the head. And this time, let's just tap all around the head. So many points on there. Just to free up that energy, stimulate it a little. Wake up around the ear. And then just stand. And just notice the energy moving around. Take an inhale as you raise your arms. And an exhale, sigh it out as you let go. And just notice. Hopefully this stimulated some energy. You're feeling it move around the body. And you're ready for the rest of your conference. Have a great day. Namaste.
Hello. Good afternoon, everyone. My name is Sharon Zarabi. I'm a registered dietitian and certified personal fitness trainer. And today I'm going to talk about a topic that I hold near and dear to my heart, something I think you love and I love too. A commodity that brings us together socially, religiously, culturally around the dinner table, and fuel for our body, our minds, and of course, our heart. If there's anything I want you to take out of this talk, it's just one thing. Throughout the week, you've listened in on a few presenters and experts who've spoken about health and wellness. And if there's anything that you can take out of this and apply and be consistent with, that change can reap huge benefits for your future wellness goals. And a few objectives that I wanted to talk about today, because there's just always so much to speak about when we talk about heart healthy eating, is where do you stand in your food IQ? So grab a pen and paper and let's see where you assess in these questions. So number one, do you eat at least 1 fruit and 3 vegetables a day? Do you include high fiber foods that help clean out the digestive system, that take longer to be broken down, that help with cleaning out any debris and release, atherosclerosis and the arteries that are important for a heart healthy diet? And those include whole grains like wild rice, farro, oats, millet. Do you include seeds and nuts into your day at least, twice, 4 times a week? Do you include fish in your meals 2 to 3 times a week, which contain omega-3 essential fatty acids, which are extremely heart healthy? Do you chew your food 30 times before you swallow? Do you go out of your way to avoid packaged foods with limited ingredients, which now will include foods that are whole, and we'll speak about what all of that means in just a moment. Do you avoid foods with added sugar? When you're stressed, do you eat until the feeling has passed? Do you wait until the feeling has passed before making impulsive decisions? Do you make it a point to take your time to eat despite feeling tired or busy? Do you eat breakfast within 2 hours of waking up to help speed up your metabolism? Do you drink 6 to 8 cups of water a day to keep your body fully hydrated? Do you limit sweetened beverages, including juice, soda, sweetened cocktails? And most importantly, do you exercise and include physical activity as part of your day? If you answered yes to most of these questions, you're on a good streak. And if there's anything that you may have put an X next to, these might be one of those things that you want to incorporate to make a change for your heart. Now, in practice for over 15 years and working with various patients, I've noticed that many people don't really understand what a healthy diet includes. And I have this image of a patient sitting on the exam room table and a doctor, and the patient asking, well, what's wrong with empty calories? If they're empty, that means there's nothing bad in them. And I think this goes to show that many people do not know the true definition of calories. For many, they just think it's a word on the back of a label. They think it turns to body fat. They think it's bad for them. And I think I always like to start my nutrition talks with understanding the premise of energy, okay, and fuel. So calories are basically the amount of heat that it takes to increase 1 kilogram of water by 1 degree Celsius. And in layman's terms, that just means energy. It means fuel. So the same way a car functions on gas, our bodies function on food. We need the right sources of calories. And in a typical standard American diet, we eat highly processed foods, mostly coming from white flours, white sugar. 2,000 calories for the average adult can look very different when it's highly processed versus whole foods. So if you're doing 2,000 calories of pancakes with syrup and orange juice and hot dogs and soda and lemonade and burger and fries, those calories are devoid of any nutritional value. They clog up the arteries, they're high in trans fat, they're highly processed, they're high in sugar, it causes inflammation in the diet, and it would be best to switch to foods that are more whole. So including fruits, vegetables, lean sources of protein that come from eggs and salmon and asparagus and strawberries. And the difference between the two is that a highly processed diet that's void of nutrients is going to leave you with lower energy levels, constantly have you craving for more of that junk food. It'll reduce your quality of sleep, It helps lower your immune system. And in a world where we're talking about recovering from COVID and social distancing and the vaccine and hand hygiene, I think it's so important to make our bodies the #1 defense mechanism that you have. And the foods that you consume and the nutrients that they contain with vitamins and minerals are going to be just that. So choosing better quality calories, which we'll go over in the next throughout our talk, is going to leave you with lasting energy throughout the day, feeling of satisfaction, not looking for food a half an hour later, improve your sleep quality, and of course, boost your immune system. But what does a healthy diet look like? And you hear me throwing out this term, whole foods, and what does that really mean? So we want to try and include dark leafy green vegetables. We want to include lean sources of protein, unsaturated sources of fats, and complex carbohydrates, starches. And what that looks like and the reason why, okay, because I'm always about the why. Why do we need to eat this and why do dietitians preach this? And the reason why is when you understand the function that all of these nutrients play in your body, you may be more inclined to want to follow. So why do we need protein? Protein helps when it's broken down, it contains amino acids, and amino acids are important for us for all these hormonal and chemical reactions to occur in the body. Protein is important for your hair and your skin and your nail growth. Protein actually takes longer to be digested, so it keeps you full longer, so you're less likely to overeat. And protein also helps with building muscle, and muscle helps with your metabolism. Dark leafy green vegetables, as you know, as you were taught even from your younger days, contain lots of vitamins, minerals, fiber. And fiber is very important because it helps clean out the digestive system. It acts like a sponge where it takes out any toxins leading you to have bowel movements. I always say whatever goes in must come out. Fiber also helps clean out the arteries. So any debris or any atherosclerosis or plaque that builds up in the arteries that can lead to heart disease in the long term can be reduced by eating high fiber foods from the vegetables. But one thing to take note is that not all vegetables are created equal. We want to try and choose the vegetables, again, that are cruciferous, that you have to chew, that are dark in pigment color. So think of spinach, arugula, wild greens, Brussels sprouts, asparagus. They have a much darker color than iceberg lettuce or romaine and cucumber. And not to say that the cucumber is bad for you. We never want to label vegetables as bad, but you want to get your best bang for your buck. So you want to try and choose darker colored veggies when available. And you want that to constitute half of your plate. And I'm going to show you some ways to incorporate that where you're not just doing, a boring salad or just having some vegetable crudité on the side, but we want to teach you how to incorporate high fiber vegetables in your everyday eating. We want to include starches, again, from the complex carbohydrates. And these are some things that you may never have thought about before, like sprouted grain bread, which is more nutrient dense because it's not made from powdered flour that comes from wheat, but is a little bit more grainier in texture. And I'm sure if any of you have tasted this before, it actually tastes very nutty. And it actually improves for me, the flavor profile, for you, the nutrient density. So try to replace any white or refined breads with sprouted grain breads, with farro, with wild rice, with bran, oats, quinoa, and we'll show you some ways to include that in the following, in the talk. You could also include starchy vegetables that include beets and squash. And again, anything that comes with color in it, if it's pigmented, it's going to have a lot of antioxidants in it, and those are going to help boost your immune system and fight off and ward off any form of disease. When it comes to fats, not all fats are created equal. Just like we spoke about calories, there's good and there's not so good. With the fats, you want to try and choose more of the unsaturated sources, and those are going to come from, think of plants, think of nature. We come from nature. We need to eat nature. So avocado, nuts, seeds, olive oil can be a better replacement to the trans fats that we see, such as hydrogenated oils and palm kernel oil. Anything that's high in omega-6, we want to replace with omega-3 essential fatty acids, which again are important for your heart health. And how do we do that? Okay, here I am speaking about all these different things that we need to include in our diet. And, in a world where, the food industry is really listening to the consumers, there is a whole array of vegetables that you can get frozen or spiralized. So if you like the texture of pasta or the shape, food has to be fun. It's something that we eat, three times a day. I hear sometimes people telling me that they get bored of salads, and how else can they be creative with the vegetables to include the fiber in their diet. And a great way to do that is with spiralized vegetables. So think of, zucchini noodles or daikon noodles and spaghetti squash, because they take the shape of this long noodle-like structure. And another option these days is bean pastas. So we now have taken legumes, so beans, whether they're chickpeas or black beans or edamame and lentils, and turn them into some form of like a macaroni shell or a long linguine that you could replace instead of pasta to increase your fiber intake. Riced cauliflower is also a great option to replace rice. Again, rice, which is usually refined and it's white in color. Although cauliflower is white in color too, it's a cruciferous vegetable, so it has a lot of those phytochemicals that we were talking about before. And again, a high in fiber, so will give you the nutritional value you're looking for. And if you are looking for flavor, because I'm not asking you to just take a frozen bag of cauliflower and steam it under the oven, over the stove, but to season it with spices, with herbs, and to give it some flavor, because you need to enjoy what you're eating. This is not meant to be a bland diet at all. You should be adding flavor to your food. And again, by chopping all these vegetables together and by adding low sodium sauces and herbs and spices, your heart will thank you. Instead of bread or flour, try grain-free bread. Usually these could be made from almond flour, coconut flour, tapioca flour, cassava flour, or again, we mentioned the darker grain bread that are made from sprouted grains, and those will have, again, a higher nutrient profile. Instead of white crackers that most of us tend to grab on the go or add as like a, something crunchy to our soups, you could try flaxseed crackers. You could try even these toasted chickpeas, or bean snacks are readily available in the supermarkets now. Again, as I mentioned, I think, the food industry is really listening in, and they're taking these whole foods and packaging them for us. Again, one ingredient item. So just make sure that you ask yourself, what is in this before eating it? Another way to get creative with your vegetables is to replace wraps of bread with collard greens. So a great option that I like to suggest for lunch or even for dinner is to take this large green leaf and put some sliced chicken on it or some sliced turkey on it. You can cut up some avocado, some other chopped vegetables, and just wrap that in this green little leaf. And that way you can still hold it as if it's a sandwich. And as we go through, again, different ways of eating, again, we live in a world where it's so fast paced. We're all about grab and go, and what can I eat quickly and what can I put together that's still nutrient dense and still heart healthy. And a few replacements and a few food swaps that I like to talk about is, instead of doing a bowl of cornflakes or Rice Krispies, you want to swap it for oats. Why? Because oats, again, have more fiber in them. They're lower in the glycemic index. They won't cause inflammation in the body. And of course, you want to upgrade your meals. So make it colorful. The more colors it has, the more vitamins and minerals it has. So oatmeal with some chopped strawberries, chia seeds or flax seeds, and then even like a nut butter. Again, in all of us are in New York, bagels are easily and readily available. And I think it's important to note that one bagel is the equivalent of like 5 slices of bread. And we don't really realize that or take that into account. So I always ask my patients, would you eat 5 slices of bread in one sitting? And usually they laugh and say no, but we tend to grab bagels and wraps, which are the equivalent of more than 1 slice of bread. So something to think about when it comes to, grabbing sandwiches, whether it's in the morning or in the afternoon, swapping out the bagel for a whole grain sprouted toasted bread with some avocado, with some healthy protein sources, maybe eggs, and then adding some veggies in there. It's important to try and include vegetables at least 2 to 3 times a day in your meals. Another option, if you're going for Mexican, instead of doing the burrito wraps with the cheese, you might want to do a bowl. So try to eat from a platter. I think that we've really associated meals on the go that you need to eat them with your hands. But I always say, it's best to use your fork because that can control the pace at which you eat. It does allow you to chew your food before you swallow. And then again, it will make it easier for you to include the vegetables on that platter. So again, colors can make a big difference. And the types of utensils you use can control the pace at which you eat. If you're going out and it's, you don't have time to cook, I know we all live a very busy lifestyle and it's on the go. And, people always tell me, like, can you just give me a meal plan? Can you just tell me what to eat? And I need them to be under 5 minutes. I always say it's so important to maybe keep frozen vegetables around, some canned items in the house so you can just kind of open things and put them together. Chinese takeout can be, easy to order, but you can do the same thing if you just have some frozen vegetables, like a low sodium sauce that you can put on maybe to drizzle over your meal. And then always have sources of lean proteins in the house or plant-based proteins, whether they're veggie burgers, grilled chicken, some low sodium turkey slices, of course, fish. And these are things that you probably want to stock up on. I always say if you can batch cook your meals, try to cook on a Sunday and a Wednesday and keep them available throughout the week. And if you're going to order out, know what you're ordering before looking at the menu, because sometimes looking at the menu can be so enticing and we tend to order foods that we probably wouldn't have thought of. And, in our minds, we have a health goal and we know that we want to eat heart healthy, but then when we look at the menu, we're tempted. So, create guidelines for yourself. Always look at your plate and ask yourself, does it have a protein on it? Does it have fiber on it? And with that, you'll be able to understand what these meals should be looking like. And, as a dietitian, I call myself even like a wellness coach because it's very difficult to talk about what to eat when we're not talking about the other 5 pillars of health. So we want to make sure that we have all these other pillars in balance. So occupationally, do you have a work-life balance? Spiritually, do you have an optimistic attitude? And I think that if you walk out of this talk taking one thing and being confident with your decision to make these changes, it will be easier. Socially, do you have a good relationship with the people around you? I mean, love is life. So we need to embrace each other's support and foster these healthy relationships with the people around us. Psychologically, I know it's been a turbulent year, but we do need to seek any mental health experts if there's something that's not making you feel well, because if you're not mentally stable, it's going to be difficult, to take charge of your health through the foods you eat. They all work in tandem. Intellectually, knowledge is power. So as you sit through this talk today and throughout all of the webinars throughout the week, try to understand, how does food affect my body? We are what we eat. Food is medicine. So when we make the right choices, everything else can fall into place. And of course, we can't talk about wellness if we're not engaging in physical activity. I'm sure most of you know that when you participate in some form of exercise, you feel good, it boosts your confidence, it helps with your metabolism, it helps lower your cholesterol, it helps lower your blood pressure. So I'm hoping that when you put all of these pillars in together, it will work in congruence and you will feel your best. Now, I know this was a mouthful, and I thank you all for tuning in. I'll see you on the panel.